Well, I'm glad to report good news for sick children and their families. Birmingham's Children's Hospital looks almost certain to become a super centre for heart surgery.
The hospital will be one of just 6 or 7 centres which will do more operations and hopefully improve survival rates. Well, our health correspondent Michele Paduano is at the hospital for us now, so this seems like really good news.
It does, exactly, and it's been chosen as a centre for 2 reasons really. One, the geography. Birmingham is in the right place, and secondly, because of the quality of the team here.
At just 3½, Finlay Joyce knows all about Birmingham Children's Hospital. The left side of his heart didn't develop properly. He had the first operation to save his life at just 3 days old, when his heart was the size of a walnut.
When he was 3 days old for the first procedure, they're working on arteries that are, 2-3 millimetres in width, and you just can't believe that they can do it, but they did, and they have 3 times now, and they're just fantastic. So
Finlay won't have to fight to keep this unit open. Birmingham is one of 3 that will survive unscathed, whatever the options, and this is why. For the period 2000 to 2008, Oxford had 13 more deaths than would have been expected. Leicester had 24 more deaths, but Birmingham had 33 less deaths than expected.
They made it better.
We're local people as well, so it's very handy that it's just here on our doorstep. Brilliant centre, brilliant work from the surgeons. We couldn't ask for any more, really.
Birmingham Children's Hospital has struggled with capacity and cancelled operations, but that's about to change. This catheterisation suite is the first part of a £12 million investment, which will also involve putting in a new hybrid theatre, which will allow them to do more than one operation at the same time. They're also expanding intensive care from 20 beds to 31 beds. The reorganisation is necessary because smaller heart units struggle to provide safe 24-hour cover and retain staff. The survival of Birmingham's heart unit is not just good news for children, but good news for the Children's Hospital's long-term survival too.
Just to say, the little boy Finlay that you saw at the beginning of that package has actually gone back into surgery, so we wish him well. I'm joined now by Fiona Reynolds from the hospital. Fiona, good news tonight.
Yes, there are 4 options being looked at, and Birmingham Children's Hospital, Children's Heart Service is in all 4 options. I think that reflects the quality of the heart service here at the Children's Hospital. And also, as you said, Birmingham is in the middle of a big population.
And of those 4 options, obviously one is for 475, another one's for 725 operations. Which ones do you want?
Well, there have to be a range of options. They're going out to public consultation to look at which is the best for the population, both of the UK and of Birmingham. And people need to get involved in that consultation to make sure that we get it right.
But what would you like? Would you like to be doing more? Would you like more surgeons?
There's evidence that the larger units do better surgery, and Birmingham Children's Hospital is already the largest cardiac unit in the UK at the moment, and we've got the best results, so I would hope that we'd be growing in our surgery.
Are you worried about capacity though, because there have been capacity issues in the past?
There have been capacity issues in the past, but that's in the past. Last year we were the biggest children's heart unit in the UK, and we are exceeding all the government targets with all of our surgery.
Okay, thank you very much. Well, we should know the result of the consultation by the beginning of July, so until then we won't know how many operations will be done in Birmingham.
OK, Michele, thanks very much indeed for that.